I was diagnosed with stage 3 breast cancer. One of the challenges in fighting cancer is getting the monies and the family support. I have been blessed that my family has sacrificed a lot of their family needs so that I was able to get my treatment. That's one of the things that kept me going, that I had that family support. Unfortunately for many, there is not that kind of support.
For the women of Belize, combating non-communicable diseases is very important. It means saving our lives. There can't be a stronger message than that. Saving our girls, saving our mothers, saving our daughters, saving our aunts. That is powerful.
We understand that for us to be able to build a proper system, to be able to extend the coverage, we need to get stakeholders, we need to get support, we need to get resources.
It's absolutely important that countries like ours join forces with our global partners, and global partners remember us, because partnering opens doors for our patients.
Prevention and control of non-communicable diseases is still a young program in Uganda and require a lot of support, both locally and internationally, and of course it requires a multi-sectoral kind of approach to addressing it in order to have enough capacity in terms of resources, human and financial and otherwise, to deal with the problem.
Can we help save millions of lives of people that have NCDs? Give them opportunity to live to their full potential, to live to the old age expected of them. That's what we appeal, irrespective of where they live on this planet, whether in the north, whether in the south, whether in the east, whether in the west. We are all together.
WHO is keen on preventing non-communicable diseases, and one of the ways to do that is through tobacco control and tobacco regulations.
There are about 300 deaths from non-communicable disease a day in the country, and half of them are attributable to smoking.
President Aquino had a social contract with the Filipino people, and one of that was the provision of universal health care.
The sin tax is principally seen and exclusively seen as a revenue generation measure. But in our case, we did emphasize that the sin tax reforms are primarily responding to health objectives.
More lives will be saved. More people will not suffer the same fate of smoking.
The malignancy of cervical cancer continues to be a major health challenge for us here in Jamaica, affecting many of our women in their most productive years.
Cancer of the cervix is prevalent where there is low socioeconomic conditions. So the global initiative is very important to Jamaica because we can't continue to have a preventable cancer causing such havoc in our country.
Jamaica is committed to the United Nations Sustainable Development Goal to reduce by 33% premature mortality from non-communicable diseases by 2030.
Since cancer, I have lived a new life. The old one is gone, and most of it is new.